Muy buenos días a todos y a todas. Muchas gracias.
Good morning, everybody, ladies and gentlemen. Thank you for coming to this launch of the eCBB. This is a health team for the care of newborns. We're starting this session. My name is Andrés de Francisco. I'm the director of the Department of Family, Promotion of Health and Life Course of the Pan American Health Organization. Today, with us, we have Marilu Valdez, Deputy Director of PAHO, Dr. Suzanne Sarruya, and other colleagues that are going to be with us during this session. The global and regional frameworks and strategies, such as the strategy for the health of women, children, and adolescents, the strategy for universal access to health and universal coverage of health, the agenda for sustainable health for the Americas 2018 to 2030, and the plan of action for the health of women, children, and adolescents 2018-2030 pursue, among many other objectives, to promote health in the course of life. The objectives of surviving to put an end to preventable mortality, achieve health and well-being, and to transform the enabling environments require actions, and they are a challenge for requiring innovative actions. The 2019 pandemic is a challenge in many respects, including not just the direct impact of the disease, but also many other impacts that we are aware have affected and continue to have a negative impact on health and the well-being of the populations. From the perspective of the course of life and the actions that the Department of Family, Promotion of Health and Life Course and CLAP develop, the perinatal and neonatal periods are of peculiar significance. The first 28 days of life represent the period with the highest mortality in the if we consider the first 5 decades of life. Likewise, it's a period during which health and development have implications that stretch throughout the life course. The access to quality care for all newborns and their families is of key importance. However, the inequalities very often limit that access. Very often, newborns, but specifically the premature and the severely sick and their families, do not have essential care. In that regard, the plan of action is sustained on the principles and values of equity, participation of the communities, multisectoral evidence-based action, human rights, gender equality and interculturalism, life course approach, innovation and research, accountability, transparency, and financial sustainability. Particularly strategic lines that are directed to reducing inequalities in terms of health that affect the women, children, and adolescents. Promoting health and universal well-being, effective and equitable for all women, children, and adolescents in the families, schools, and communities all along the life course. Third, to expand the equitable access of women, children, and adolescents to comprehensive, integrated, and good quality healthcare services that are person, family, and community centered. To strengthen the information systems for the collection, availability, accessibility, quality, and dissemination of strategic information, including data and statistics on the health of women, children, and adolescents. under the principles proposed in the plan herein. All of them are expected to make the objectives come true. Those principles and values. From the Department of FPL, under the framework of actions that the Pan American Health Organization promotes, we promote the development of innovative tools that may enable an equitable access to information of quality to improve knowledge, practices, and care of the healthcare teams, mothers, fathers, families, and caregivers, and to improve the care that they provide to the newborns in our region. From that point of view, we developed the app that we present today. The response that we expect to provide with the SLBB is under the strategies and actions is in key with those what is proposed by PAHO. We are going to listen to Marilu Valdez, assistant professor of the Pan American Health Organization, who will talk about health and innovation in the era of information and communication. We are very happy to have Mrs. Valdez with us participating in this launch. Now, after her, Paula Otero, a doctor of the Department of Health Information of the Italian Hospital of Buenos Aires, and Dr. Pablo Duran, Regional Advisor of Perinatal Health, CLAP, FPL, who will give you the foundations for this app and its characteristics. And finally, Dr. Suzanne Sarruya, Director of the Latin American Center for Perinatology, CLAP, and WHRH, that will give you the final comments. So I welcome you again, and we hope that this session may provide you with the information that will enable us to change the life of the newborns and their families in the region. Thank you.
Dr. Valdez.
Dr. Valdez.
Gracias, Dr. De Francisco.
Thank you, Dr. De Francisco. Good morning, everybody. I'm going to speak English. Thank you.
It is such a privilege and a pleasure to join you today to talk about the incredible power of information and communication technologies, which increase the efficiency and effectiveness of health systems and improve the health status and quality of the lives of the people that we serve. The World Health Assembly in May 2005 adopted the first ever resolution on e-health. In the same spirit, in 2011, PAHO, through resolution, adopted a strategy and a plan of action on e-health to contribute to the sustainable development of national health systems, including veterinary and public health. And in 2017, the World Health Organization submitted the global report entitled mHealth, Use of Appropriate Digital Technologies for Public Health. Now, these strategies and plans of actions call for several critical steps, and these include among them, number one, increase capacity in member states to implement digital health solutions to accelerate progress toward universal health coverage. Two, formulate e-health strategies in countries that do not have them and monitor those that may already be in the implementation phase. Three, strengthen the region's capacity by supporting the Information Systems for Health initiative. And four, establish a roadmap for the role of e-health within the framework of the Sustainable Health Agenda for the Americas, 2018-2030. PAHO's Information Systems for Health will enable better decisions, policies, and actions in member countries through effective health systems that ensure free and timely access to quality and open data and strategic information using the most cost-effective tools. As Dr. Francisco said, the COVID pandemic has directly impacted our population's health, causing the disruption in the delivery of essential health services throughout the region of the Americas. The effects of COVID-19 are evident in the set of interventions linked to reproductive health, pregnant women, newborns, and children. Round 2 of the National Survey on the Continuity of Essential Health Services during the COVID-19 pandemic, which was published in 2021, shows that on average, of the 29 countries in the Americas that responded to the survey, 41% of them reported disruptions in the delivery of reproductive, maternal, newborn, children, and adolescent health services. And this is really a worrisome challenge for us all. Other findings of the survey include that national digital health record and information systems, telehealth, mHealth, and e-learning tools are increasingly available. That's the good news. However, rates of implementation remain low. And second, the promise of technology will contribute to addressing better results, not only in improving health, but in actually helping us to reduce inequities. And thirdly, key interventions to reduce inequities and improve accessibility of quality reproductive health and perinatal health and maternal health need to be prioritized and reinforced. Strengthening access to evidence-based scientific knowledge in a timely manner for health teams, family members, and caregivers is a priority strategy for the Pan American Health Organization. The development of PAHO's electronic application that will be presented here today clearly demonstrates this priority. This app, particularly in the commemoration of PAHO's 120th anniversary this year, is an innovative instrument for information that can empower healthcare professionals and patients alike. So we're excited to work with all of you to roll out this app and put it in the good hands of many for better decisions and actions. Thank you again, all of you, for allowing me to be with you today. Back over to you.
Muchas gracias, señora Valdés.
Thank you, Mrs. Valdez. Thank you, Dr. Andrés de Francisco, Dr. Sarrulla, and of course, thank you all the participants who are attending this session today. And it's within the context that both Mrs. Valdez and Dr. de Francisco mentioned that I can say that it's a real pleasure to share this part of the presentation with Dr. Palma Otero. She was Paula Otero is of the Italian Hospital of Buenos Aires, a collaborative center in knowledge management, collaborating with PAHO, and with whom we have developed this app that we're going to share with you. Now, before delving into the characteristics and the features of the app, let me share with you some general aspects, essentially those related to the rationale that gave rise to the development of this app. This is a process that took us several months. Now, originally, several years ago, it's based on the work of many years. Now, the rationale for this app is essentially has to do with the care of newborns based on on a rights-based perspective. We are convinced that health of the newborns needs to be sustained on this rights perspective, the right to life, survival, and development, the right to identity, and to be protected from violence, abuse, or neglect, but also newborns that are in the midst of families taken care by parents or caregivers, and it's the parents and the caregivers that are not just key players, but also they are the beneficiaries of promotion, support, advocacy, but especially support to help them do their job that in this 28-day campaign is promoting, that is taking care of newborns. And of course, they have the right to enjoy the highest sustainable standard of health to help them develop. Now, so there's a dual perspective that we have also based this app on, and it is precisely the provision of quality care, but together with an experience of care that needs to be effective with the engagement of the families and caregivers, with the emotional, social support and development may be related. So both the evidence-based care and the experience of care may transform into positive experience. So that in the framework of healthcare with a multidisciplinary, motivated staff may contribute to achieving the health outcomes expected. So this chart summarizes that perspective that inspired our app. It's that baby where the experience of taking care and to have committed staff in our healthcare teams are the focus or are the beneficiaries of this app that we are presenting. And of course, this is not, this app was designed in a peculiar context, initially before the pandemic in 2019, also in coordination with colleagues of the Italian hospital. We conducted an overview on the availability and the usage of ICTs in the field of neonatal health. And we could confirm that although there are previous experiences and technological development in that field, it is also the case that the lack of expansion and the lack of assessment of the results of these technologies was important. And so in the framework of the pandemic and during the pandemic, as Mrs. Valdez said, the disruption of the healthcare teams and the limitations for effective evidence-based data promoted our interest to develop this app. So, together with the Italian hospital in Buenos Aires, we started to develop this and this app. So now I want to give the floor to Paulo Otero, who will tell you the path we followed as we moved forward developing this app. So Paula, you have the floor. Thank you, Pablo. Well, as Pablo very well said, we started with a literature review and we saw that the possibility for working in the development of an app, both for the healthcare team and caregivers, could enable us to reach our targets. And the context of the pandemic, of course, made it even more evident. So based on the contact that we had with the collaborative, with the PAHO Collaborative Center, we got excited with this literature review. So usually the experience that we have at the hospital on the health ITs, we focus on user-centered design. That means that it's a constant circle, an ongoing circle where the design, we see in a survey what it is that they need. Then we focus on the target population. We conduct tests of the services that or the app that will be offered in a certain setting. So this means that this is an endless loop where you can start by thinking, for instance, of medical record for an office or for a doctor's office. Then you can add information so that it may be mobile friendly, and then we develop something for doctors and then nurses, etc. And finally, of course, the objective that is the population. So this concept of a user-centered design where we involve them from the beginning, we believe that is the best path to design apps that may be really useful. Thank you. In that line, how can we identify users? Well, we know that of all the existing population, there was a group that were eventually the ones that would use the app. That sample aimed at being representative so that we can finally reach the target population. So we wanted to ensure that the target population would finally have lead us to the end users. We know that of all the population, we have to try and reach those end users. And for that, to that aim, we conducted a survey. It's an online survey with just 10 questions, targeting two profiles, caregivers and professionals in general. And we had 122 answers as a whole. This survey helped us see whether what we thought would be useful, whether the users would be ready to use it, and whether they considered that it was what they needed. So in this survey, we found that from 50% of the surveyees would download the app after learning about it, and 30% might download it. So we had 80% of the target population that is interested in the app. So after explaining the concept a bit and having the okay of the end users, and based on that census of perception of users, it was based on that we developed the app. So we worked first of all on the use cases. So it's important to consider who was this directed to, the health team or caregivers, and why? Well, so that they can learn of a diagnosis and symptoms, and to seek information quickly and good quality information. Because one of the things that we saw during the pandemic was that the WHO proposed the concept of infodemia and the problem of having poor information and the bad impact it has on health. Then the what, and so text, image, videos, and audio, because we would make the most of the multimedia tools provided by ICTs. And then where the idea is to have it omnipresent at work, at home, during the office, while traveling, on times when in idle times you could read the information. So this helped us think of the app together with the team that gave us support from CLAP. And then when so that the information would not be mixed. We could have prenatal information, everything related to preterm babies, and then week after week, the first 28 days. So these use cases enabled us to develop the apps later on. So as you see here, there are different stages. We start with mock-ups that are something very basic and crude, and then in the design and the testing, and finally the agreement with the users, we reach the final solution, both for apps with Androids or with iOS phones, that is iPhones. Why did we think of working with an app in the mobiles? Well, first of all, because not everybody has computers, but obviously everybody has access to a mobile phone. It's an app that does not require too much memory. It uses web-based resources and it has a lot of information saved. So if there's poor connectivity still, you can access a lot of information. So this was just to tell you of all the steps that were taken during development so that we could reach the final result. Now, Paolo will tell you a bit what the app is all about. Thank you, Paula. Indeed, we wanted to share with you how the name was conceived. Well, we had important debate and we thought of the aesthetics to take care and to harmonize in all the app. eCBB is about e-healthcare to babies, well, in different languages, e-salud cuidando a nuestro bebé in the different languages. So the idea too is that from the name already may suggest this care that we want to promote. The app is available both in Google Play platform and in App Store. So the mobile phones that work using the Android system or the iOS may have access to the app and download it, as we will tell you now. Now, before doing that, after downloading the app in your mobile, you will see the homepage that will take you to the second, where they provide general information and a searcher, but you also have thematic groups, and the contents are arranged based on these axes or thematic groups that arrange the contents. Now you see the screen in Spanish. The general aspects are available in English, and in future days, the content will increase in the different languages, each content with its illustration, with the links to support documents are going to be available in the different languages. As you said, it's an app that is aimed at families and caregivers, but also healthcare teams. So the various topics and thematic access you see here, there is a list, and this list is even longer. This is not exhaustive, and it will expand as different contents are incorporated. And so they're going to have differential approaches in depth in the links, depending on whether it's the healthcare team or the families that have access to those contents. But of course, and we at CLAP and at CLAP and PAHO, we believe that this is just the starting point. It's the kickoff of something that will imply a continuous and ongoing work. So in terms of for the future, and we commit ourselves to that, the content will be updated and novel and new information that arises either in terms of technical documents or scientific evidence or more general information gets permanently updated. So all the basis for the content, and we believe that this is also an important value of the app, arises from the evidence that PAHO and WHO provide, so that that value of an information-based app that is supported institutionally and scientifically, that provides quality information. This enhances the importance of this app. So as we said, the content will be expanded and developed both in English, French, and Portuguese, in addition to Spanish, and something that we consider to be important, and that is why we organize this launch session. And we believe that it's important in the future to strengthen it, using it, disseminating and evaluating it. So the technical cooperation that PAHO provides to the countries in the region, the idea is that there will be support. Dr. Otero mentioned that the users had already expressed their interest of the content and the way it's presented. So the idea is to provide with the mechanisms to support the countries in the different contexts, so that we can permanently adjust and adapt the contents and the presentation so that they may respond to all the needs in the region that we know are varied. But the commitment is that it may be directed, target everybody based on an equality perspective, providing useful information for all.
Therefore, the idea is to receive comments and input from all users, and the application also includes this possibility of sending comments, allowing to have feedback, to have continuous improvement of the tool that will in the end have the expected outcomes. Of course, well, all experts in the QR code, you will observe the corresponding QR code to be downloaded, be it for Apple devices or Android devices. So right now, you can pick up the QR code and download the app in your mobile phones, begin to use it and disseminate it, and above all, to be spokespersons for this tool that we believe that in the current context of the COVID-19 pandemic, with the constraints to access information and care, but also with progress made, as the Underdirector of PAHO stated at first, that technology currently, together with the commitment of PAHO to advance, will signify a new manner of providing technical cooperation and reaching health teams and families and caregivers, as stated in the framework of the perspective from which we considered this app. So thank you for your attention. I will now hand the floor to Dr. Cerugia. Thank you. Thank you, Pablo. My compliments both to you, Paula, and the whole Italian hospital team. I don't know if you can see the app right now. The idea is to continue. Well, I'm going to request something that isn't frequent. I don't know if you've read the QR code, but please enter, if possible, in your mobile phone. Go to the store and download our app. It takes very little time. I just did it, and I couldn't even begin to count the seconds because it was so fast. So please take your mobile phones, download it, and then you'll have this app and share it with whoever you please. Most of the people listening, I observed that Teresa and Cristina and different people have already downloaded it and stated it in the chat and added that it's been easy. So thank you, Pablo. We want you to download the app, and after doing so, we will have all the different screens available. Today's presentation is in 3 languages, Portuguese, Spanish, and English. And it is possible for you. And of course, this is extremely important for us. You will find it when you look up PAHO and let it be known to the colleagues that couldn't attend today. And here I feel like a YouTuber. You like it, and this is important for us because we're disseminating a product that is very important for health of children at an essential stage. It's free of charge, so people ought to be aware of this, and it's important for everybody to know it. An important issue regarding the application is that it's something that Pablo said at first, and I really love it. When we visualized this, we were thinking of something regarding this specific period, but care, but also love. That is why the campaign is to love and care. And each day in February, we will be speaking about the different interventions and the evidence of importance in this regard. It's likewise important for you to be familiar with this material. It's quite easy now in a perinatology consultation to tell the mother and the father and the rest of the family. And if you have any doubts, please download this app in your mobile phones, and at home you can read more about different subjects. Well, we have several questions here. There's a very technical one regarding the manner how we can upload this in Google Play and Apple Store. Well, the answer is long, and we'll tell you about the different steps taken to achieve this in CLAP to help all the people who have this sort of application to do so. The idea is that these health applications that are free of charge could be disseminated throughout. But now I have a question for both Pablo and Paula, and I think it's something that we always have people entering in the middle and wanting to make questions. And I believe that it is important, Pablo, to further discuss the different types of users that could use this app and what type of training does it provide. And here I reached something that both Pablo and Paula and myself heading the center really appreciate. We really want to hear what you have to say. You could say, I have the app and I have this sort of suggestion. That's what I would love. For example, ask us to discuss different subjects. Now I hand the floor to Pablo to further elaborate on the type of app user. The floor is yours. Thank you, Susanne. Indeed. As mentioned, the end users are primarily health teams and families. So we've done our best, and we will continue doing so, including new contents, to adapt both the language and type of information and support documents for the different situations so that families will find this stated in a simple language according to their needs, but anyhow geared to the subjects that are important in relation to health care and the development of newborns. So when entering the app, it will ask you to identify the sort of user you are in each case in order to have the necessary information in the more appropriate manner, as stated by Dr. Paula Otero. And Paula, of course, if you want to add on, you're free to do so. The idea is to make progress in the app and in the consultation process. We developed the app taking into account the users' views, both families and health teams. In some cases, people were on both sides. So maybe, Paula, you want to add on? Well, I hadn't said it. Thank you both, Pablo and Suzanne. I mentioned it very briefly, but in the first survey conducted, the idea was to have a feeling of the usefulness of the app and if it fulfilled the necessary conditions. So with the answer of 80%, we could start. But I wanted to follow up on what Suzanne said. The app is only useful if the users make it their own. So the feedback of each user is very important. We want suggestions on different materials that may be necessary, because that is an end goal. We want the user to have it as a tool useful on both sides of the counter, both the caregiver and the health team. This first version is in Spanish. And of course, we will translate the contents and include them. All the information included has been validated by CLAP, and this entails added value. We have an app with information that has been surveyed by CLAP to guarantee the quality. So it's her whole responsibility. And of course, as a collaborating center, together with CLAP, the idea is to have validated and quality information. So of course, the work has been hard. Some people ask how to collaborate. Well, we welcome any suggestions. People in obstetrics also seem to want a similar app. And indeed, this is a first step. And as Suzanne said, CLAP did the hardest work. They did the different steps to develop the app and have it approved to be available in App Store, both Apple and Google Pay. There were difficulties, but we managed to do it. It wasn't easy, but CLAP did it. So somehow they will guide the other people with initiatives to do so in a similar way. Thank you, Paula. Thank you, Pablo. Laura Alvarez. We already have one for pregnancy. There was a stage for focus groups to know what were the questions and doubts women had. And together with women, we found that it would be very important to have that. It's nearly ready, and we'll launch it in this semester. In other words, it won't be called eCBB, baby, maybe something about mommy, but the idea is to include mother care throughout pregnancy, and there's some contents we're considering for this one. For example, the postpartum period for the mother within this same app. There are questions in other languages. I think Pablo already discussed it, but I'll hand him the floor. And another issue had to do with milk banks. I think that one of the queries, and I always repeat this. I am the mother of a 30-year-old baby. And even though he was already a physician, he had doubts about breastfeeding. And it's been wonderful to have questions from friends to help us to breastfeed nearly a year. And the issue about the milk banks is something we have worked on very well in Brazil, where we have an agency. It's a reference center for WHO, a collaborating center in the area. And we have a lot about breastfeeding and how to help mothers, what must be done. And in the end of the consultation, we can say, download this app. And now I hand the floor to Pablo to discuss the timing about the other languages. And as you all know, in the region, we have 4 official languages: Spanish, English, French, and Portuguese. We'll do it in all of these languages, but there's a time issue. So we'll have it in all these languages. Pablo, do you want to complete this information about the timing of the languages? Yes, thank you, Suzanne. Indeed. As Paula Otero said, the first development was in Spanish. At present, all contents you can see in Spanish today, although they're not all visible, they have been included in the platform in English. So the idea is to continue with the IT development to make them visible in the coming days. And we trust that very soon, all the information we now have available in Spanish will be available in English, and so on, including contents in the 4 languages. Today, all the information is in Spanish. The legal information is also in English, and we think that it will be completed in the coming days, and French and Portuguese in the coming weeks. And since then, automatically, every content uploaded to the app will be uploaded in the 4 languages simultaneously. So we won't have this delay that was due to the initial development problem. But this is practically a reality. Thank you. Thank you, Pablo. I wanted to share another function of this app so that you can share things with us. I observe that all these people are so wonderful, and that's why we have this session. They are asking about other contents, sepsis and others. Please write. It's very important to us. We started with what we believed was most necessary from the standpoint of what a mother needs from a health provider or professional, be it a caregiver, a nurse, and to have this content. Why is it so important to have it in a PAHO app, Pan American Health Organization and the Latin American Health Center? Because you can trust in it 100%. Everything included has the best evidence available, and this sets the difference with the other apps. There isn't an app for the first 28 days, and I'm sure that everybody that has this experience know that this period, the first days of the baby at home, and particularly when it's the first baby, that's more difficult. Well, many doubts come up. So we began with this content, and this is a very unique app with this possibility for people to consult and write back within the app. So if you search where you have contact, because at first in home you have who we are, we introduce the people in class, and you can also send an email, and you just click and we'll receive it, And with it, we'll be able to better understand and respond to your queries. There's a very specific topic of great importance, and we must consider it. I have the app open right here, and I think that maybe Pablo could further elaborate on what we did with the 28 days campaign and share the area with doubts. Here we have frequent questions. I hope you all downloaded it. So, for example, a question we always received, I'll go to a very frequent one. I'm not going to discuss vaccines, but how to wash clothes. But I'll ask Pablo to choose whatever he wants to pick. He's a pediatrician. So what did parents ask you more frequently in the office just before ending the consultation? The floor is yours, Pablo. Thank you, Suzanne. I think that if we consider the perspective of the newborn and growth and life course and different needs, breastfeeding and how to start it and all the different challenges, particularly in the first hours and day, would be one of the most central issues that both in PAHO and CLUB we really appreciate. And breastfeeding and all the different contents to promote and support the onset and maintenance of breastfeeding are key issues that both in the app and in the 28 days campaign have been highlighted. In the chat, there are questions about different mechanisms to report violations to the code of substitutes. Well, it hasn't been considered in the app, but any information related to these issues, be it maintenance of breastfeeding, early onset, and everything regarding the 10 steps is currently included in the app, will deepen further in each of these steps, promoting how to do so in the health teams, in the family and caregivers, and the different roles and places and questions and mechanisms, because of course, reporting and surveillance mechanisms are very specific in the different countries, so that in this sense, the idea is to have in the app the necessary information, recommendations, and support to the stand. But then infection prevention, washing the baby, bathing the baby, and aspects that are very common and essential, but as Suzanne said, particularly with the birth of the first child in the family and home, well, there are questions. So the idea is to gradually approach all these topics to be useful and meet our goal. Thank you. Thank you, Pablo. I wanted to share something more for those who have downloaded it. If you go to a different topic, health professionals in particular, you'll see something written as source of information. And when you press, you have the publication available in PAHO, and that may be downloaded if you wish to deepen further. Somehow, this application then is for health professionals, of course. They will enjoy it more. It's a repository with the best information and publications that are updated and available currently. And sometimes people say, well, where did I read that? But here in the app, you'll find many citations of different publications. Well, it's late. We're reaching the end. We still have a video, but before bringing it, I wanted to tell you something we always discuss in CLAP and that I believe is fundamental, the future. And we had to think fast about the future during this pandemic. Well, we must invest on self-care. Self-care is the most powerful innovation. If somebody knows how to take care of themselves, feed, care, and love their babies, and how to care for their own pregnancies, and this will be in our next app, they'll be happier and have a healthier life. So innovation is self-care, and self-care requires information, quality information that can be relied on, as is the information provided by PAHO. So just at the end, we want to thank all the people who participated, our director, Andrés de Francisco, the assistant director, Dr. Mary Lou Valdez, Pablo, and who's the mentor of all this activity, and this with our regional director, well, of course, with a wonderful team that prepared this app. It's for you, of course, it's yours. Please, Lan, download it and disseminate it, share it with colleagues, make this app be useful to all. I also wish to thank the team behind the scenes. We have interpreters, translators, people coordinating, support, Ignacio, and Ana Artigas, that is the general coordinator for communications. So for everybody, thank you so much for being with us. Thank you, merci, muito obrigada.
Y una vez me habían dicho que el amor se multiplica, y es así. Es muy impresionante la sensación del amor profundo, como te atraviesa.
Dos bebés, doble cuidado, por ejemplo con el tema de la alimentación. Tengo que anotar cuánto le di, cuándo le di, también pendiente de las vitaminas que hay que darle, o la curación del ombligo durante los primeros 10 días.
Pues para cuidar a la recién nacida yo le di su tetita y pues así como le mira, está gordita y hasta el momento sigue tomando lactando su leche materna.
Lahnaneu y Ischel y Arreco van a significar juntir chue y cher la misma familia. Chaque también Arrecho ya una oportunidad che ojo hunan utat y ruk Arre chakrakwi oh su uk ishik hunakal.
She was born premature. We saw the immediate benefits of breast milk. She had no infections. There were no complications. She was able to come home with us.
Borja, mi bebé, llega a una familia monoparental, pero con muchos primos, muchos tíos, muchos abuelos amorosos que estaban deseosos de que llegara y no se encuentran palabras para algo tan inmenso.
Nos dio COVID a mí y a mi mujer, pero había que estar al pie del cañón y levantarse de la cama con 39 de fiebre. Lo que a mí me demostró el nacimiento de Martina en el contexto es que el amor por una niña genera fuerzas infinitas.
Foi o dia mais feliz da minha vida, mas também foi o dia mais preocupante da minha vida. Eu tive vários cuidados em relação à pandemia. Eu só permitia visitas a pessoas mais próximas mesmo da família.
Desde que llegó Lucas me cambió la vida para algo muchísimo mejor, me enseñó a luchar más por todos mis sueños. La verdad que yo llamo la maternidad como algo, una experiencia caóticamente hermosa, algo que te cambia pero es para mejor siempre.
Pues sí, qué manera él pueda crecer más sano, de una manera que nada le afecte, pero creo que lo voy a ir aprendiendo poco a poco.
Fue como una nueva oportunidad que nos daba la vida para dar y para recibir amor. Ese motor nos llevaba a seguir formándonos para hacerlo bien.
No tenía leche al principio, ¿no? Y cuando ya empecé a tener la leche, pues el bebé, como era prematuro y chiquito, no tenía fuerza para succionar. Hasta que al 5.º día empezó pues a agarrar un pecho y al 10.º día el otro pecho, que eso ya fue un alivio para mí.
Como que el cuidado más importante que he tenido es traspasarle toda la tranquilidad y el amor del mundo. Mudarla, hacerle cariño, darle comida, preocuparme de que su piel esté suavecita, pero principalmente de darle amor.